Welcome to the Recommended Daily Value Podcast, your daily dose into the health and wellness world.
Welcome back to the Recommended Daily Value Podcast, where we dive into everything health, fitness, and nutrition related 5 days a week in 5 minutes or less. This podcast is brought to you by Umzu, and I'm your host, Tyler Woodward. If not already, hit that subscribe button because today we're talking about how coffee may lower your blood pressure. As if I needed another reason to drink coffee. This study in particular is interesting though because acutely, or one of the short-term effects of coffee consumption, is an increase in blood pressure. At least until you become caffeine or coffee adapted, aka your body gets used to regular coffee consumption. So in this study, it's a longitudinal or cohort study, and they utilize data from the Brasilia Heart Study, which is the longest ongoing European epidemiological study. The study used a randomized sample of the rural population of the small Italian town Brasilia. Sorry for me butchering the pronunciation. At the start of the study, they had 2,939 Caucasian adults, 1,491 being men and 1,448 being women, all of whom did not have cardiovascular disease, at least at the inception of the study. Then every 4 years, the participants were clinically evaluated, and I quote, a detailed personal history and physical examination assessing lifestyle and dietary habits, smoking status, and ongoing pharmacological treatments, anthropometric measurements, which are things like height, weight, waist and neck circumference, body fat percentage, etc., resting blood pressure, heart rate, and a 12-lead electrocardiogram, plus familial history of cardiovascular disease. For this particular study, they also collected food intake via a questionnaire 12 months prior to the study, which included a question on their coffee intake. On to the results. In the analysis, they compared 720 men and 783 women, excluding individuals from the study who did not have sufficient data collected on them. Hypertension, aka high blood pressure, was diagnosed at a systolic blood pressure of 140 milligrams mercury. They then compared the coffee consumption across the cohort relative to their blood pressure. Within the group, 14.6% of individuals did not regularly consume coffee, 27% drank a cup a day, 48.3% drank 2 cups daily, 6.6% drank 3 cups daily, and 3.5% drank more than 3 cups. They also accounted for active smokers across the subgroups, which were pretty much evenly distributed across all 5 groups. In the study, they found that the more coffee you consume daily, on average, the lower your blood pressure was, along with a few other metrics of hemodynamic parameters, basically other metrics that are closely related to blood pressure. Meaning, if you consume greater than 3 cups of coffee daily, your blood pressure was on average lower than those who consume 3 cups daily, which was lower than if you consume 2 cups daily, and so on. So what can we take away from this study? Mostly that consistent coffee consumption has a positive effect on maintaining normal blood pressure. And if we extrapolate all the other data on coffee consumption, we can assume that it has a net benefit on overall cardiovascular health. What I thought was really interesting, though, was that they found that normal weight individuals and obese individuals are less protected than overweight ones. So according to this, you want to have a little bit of extra cushion for the pushing to reap the most benefits from coffee, but not too much. Not that I'm advocating for intentionally gaining weight, I just thought it was interesting. The authors also mentioned that caffeine itself is not what appears to be having this protective effect from coffee, as other data has found that there is no difference between caffeinated and non-caffeinated coffee on the cardiovascular and blood pressure effects. Rather, it must be some of the other polyphenols found in coffee, including things like chlorogenic acid, other alkaloids, diterpenes, among other beneficial compounds found in coffee like quercetin. And just an FYI, the darker the coffee roast, the more of these antioxidants will be found in it. Well, that's it for this episode. So remember to enjoy your daily cup of coffee, if not a couple. And if you enjoyed this episode, make sure to hit that subscribe button and share with a friend. Remember, these opinions are my own, based on my own research and experiences, and is not medical advice. Till next time, be good.